Hi, Dr. Nikki. So my article was The Effect of Live Music on Decreasing Anxiety in Patients Undergoing Chemotherapy Treatment by Alejandra J. Ferrer. Um, this was a study done, the purpose was to investigate the effects of familiar live music on the anxiety and physiological levels of patients undergoing chemotherapy treatment. This was an experimental study with a pre-test, post-test design. So they had a questionnaire before and after, as well as they recorded heart rate and blood pressure before and after. So that's how they did that. The hypothesis that she made, patients receiving the music intervention would A, lower their anxiety levels, B, experience a decrease in heart rate and blood pressure, C, improve their levels of negative reactions. This looked at fatigue, worry, fear, and then D, improve levels of positive reactions, which were included comfort and relaxation. So there was 4 main hypotheses that they made. Scroll down here. So they had 50 participants, 24 male, 26 female. All were cancer patients undergoing chemotherapy at Tallahassee Memorial Healthcare Center in Florida. The mean age was 55, and the age range was 21 to 78. They didn't specify men and women on that, but so that was the participants. The method, it was a pre-test, post-test design. There was 2 randomly assigned groups, experimental and control. The pre-test it had 3 descriptive questions, and then it had 6 VAS questions for both groups. So look at the visual analog scale was what I was trying to say a second ago. And then the post-test looked a little different for the control versus experimental. So for the control, it just had the same 6 VAS questions, but the post-test for the experimental group had those 6 questions, and as well as 3 ending descriptive questions about their musical experience. So that's how that looked. The independent variable was the actual music therapy intervention, which consisted of live patient-preferred music, and it was singing with guitar accompaniment. And the dependent variables were the visual analog scales in those questions, as well as the physiological parameters, blood pressure and heart rate of the patients pre and post. So kind of how it happened, the procedure. The subjects, or possible subjects, were approached by the researcher somewhere in the first 30 minutes of their treatment, which normally lasts about 3 hours, I think it said. So she would ask for consent to participate, and if they did, no matter which group they were in, they would complete an anxiety questionnaire. And while they did that, the researcher would be able to access their medical chart to see their blood pressure and heart rate before they started their treatment that day. So they would have that would be their pre-test of both of those physiological parameters. If they were going to be in the experimental group, they would, immediately after they do that first form, they would get 20 minutes of live music. As they started, the participants were asked to name some of their favorite songs, favorite genres, styles, and the therapist would try to incorporate that, but they were also encouraged to request other preferred music and sing along as they went if they had other requests. After they did that 20 minutes, they would do that second post-test, that second questionnaire, and they would have their heart rate and blood pressure taken again and recorded. For the control group, once they did their pre-test, when they did their questionnaire, they would receive no further contact from the researcher for about 20 minutes, so about the same amount of time. And once that time had passed, she would come back in and just ask them to fill out the second questionnaire and have their heart rate and blood pressure taken again. So yeah. And it was just done that one time. It wasn't over a certain period of time. It was just that one day that the whole study really happened. So for the results and tests, the statistical tests that were used, there was some descriptive statistics in those first 3 questions that they were asked in their pretest, as well as just some general questions about their music experience at the end. But then the main thing that they were looking at had a t-test to measure if there was a statistically significant difference between the 2 sample groups. So some information that they found, 64% of the participants had experienced chemo 6 or more times prior to the study, and 10% were undergoing their very first treatment, which later I'll talk about too, but that might have been something that could have affected their anxiety levels and those other dependent variables that they were looking for. So to just to go back, the variables that they're measuring, they're looking at anxiety, fear, worry, fatigue. Those are the negative reactions. Comfort and relaxation, which are the positive, and then they're looking at heart rate and blood pressure. So all of these really, even if they were not statistically significant, did have they did support the hypothesis. So they did have either a positive or negative, like increase or decrease as they were supposed to. For anxiety and fear and fatigue, of those negative ones, all of those were statistically significant decrease. So there was a big enough difference between the two groups that it did actually show that the music was more effective in decreasing those three. The only one of those that was not statistically significant was worry. Both of those did show a decrease, but it just wasn't statistically significant. For comfort and relaxation, I want to say that relaxation did have a significant increase, but there was also a positive increase in the control group as well, whereas on the other one, on worry, the worry actually got worse for the control group. So they were both like better, I guess, at the post-test, but there's still a significant increase in relaxation. For comfort, there was no significant, statistically significant difference for either group. The heart rate, actually both of the groups' heart rates had decreased from pre-test to post-test, so it was not significant because it was kind of the opposite of what they were expecting. And then for blood pressure, it actually looked at the systolic and the diastolic. So for the systolic blood pressure, there was not a significant difference between the two groups, but for diastolic, it was significant. So those are actually slightly different. Also at the end, in those three questions that they asked the experimental group, they asked if they enjoyed listening to music while receiving chemo, did they think that the music helped reduce their anxiety, and would they like to receive that service again in the future? And all of them, for all the participants, all three answers were a yes. So that wasn't really part of that statistical test, but it was part of that descriptive analysis at the end. So, like I mentioned, all of the hypotheses that they made were supported, but some of them did not show a significant difference between the two groups in the long run. So some of the control groups still improved, even though the music might have improved more, but it wasn't significant. Possible modifications, I think the biggest one is probably that they had some patients who had gone to chemo that many times, so 6 or more, and then they had some that were going for the first time, and I would imagine that that would already play a role on anxiety levels and some of that fear and worry. Theoretically, the music could still make a difference, but I think that would be better to have either everyone the first time or everyone who's been there many times, because it mentioned that some people had reported that they can kind of remove themselves in their mind from that situation, so they might have less anxiety upon starting, so it might not make as big of a difference. I think also it would be interesting to look at this over time. I know this is kind of a one-shot thing, but to see if there's a trend, if there's, a certain day that made them more or less anxious. Also, I think it would be interesting to look at unfamiliar music. If you just came in and played music in like a receptive manner, just brought in classical music or brought in something like that, if that would also have the similar effect. So that's kind of a whole different study on its own, but it would still be interesting to look at. And that's pretty much it that I have, so there we go.